Picture the scene. A town hall meeting in Lincoln, Nebraska. The air isn't filled with applause. It's thick with frustration. These aren't diehard fans. They're concerned citizens, and they have questions about why their lives are getting harder. Someone gets up and asks the local congressman, Mike Flood, a direct question. Why did you vote to cut SNP benefits and health care? The answer, as reported, began predictably enough with a familiar line about how the country doesn't have endless money. But then, according to reports, he went on to explain that the billionaires do have endless money, and his vote, as he stated, was to make sure they got more of it. The room just erupted, the booing was overwhelming, and as he was being drowned out by the very people he's supposed to represent, the congressman, visibly agitated, stopped trying to explain policy and reportedly yelled back at the crowd, his voice raw with anger, "You do not get free health care." That single shouted sentence, that moment, as some interpreted it, where the underlying tensions of the debate were laid bare, offers a stark glimpse into a central conflict. It suggests that these discussions are not just about budgets. They can be perceived as declarations of who matters and who doesn't, and that one angry outburst in Nebraska is just a tiny snapshot of a much, much larger and more complex reality unfolding across the country. Okay, so let's unpack this a bit. That moment in Nebraska, that really raw outburst, it shines a light on some really fundamental questions we're facing today, doesn't it?
It really does.
It's clearly not just about budgets and policy spreadsheets. It feels like it goes deeper to who holds power, who gets left behind in all this, and maybe even what kind of society we're actually building piece by piece.
Exactly. And what's fascinating, I think, is how that single incident, that flashpoint, connects so many threads that might seem separate at first glance.
Right.
You've got the immediate, very real impact of these policy decisions on people's everyday lives.
Yeah.
Then there are the kind of intricate gears of our democratic process, how things like voting maps get drawn. And then there's the bigger picture, the larger economic forces that are always swirling around, sort of deciding who benefits and who ends up bearing the burden.
So this deep dives, we're aiming to pull back the curtain on those connections, show how these big abstract forces actually play out on the ground.
That's the goal, to see how it all fits together from the town hall floor to the national economic stage.
Okay, let's start right there with that direct impact hinted at in the town hall. The cuts to SNP benefits and healthcare. It's so easy to talk about these things abstractly, isn't it?
Numbers on a page.
Exactly.
Yeah.
Spreadsheets, budget lines. But behind those numbers, there are real people. And I think to really get the weight of these policy shifts, we have to look at how they land in someone's actual life.
You have to humanize it.
Right. Let's talk about someone like Eleanor.
Okay.
So Eleanor, she's a 78-year-old widow, lives in the Midwest. She's been in the same house for over 50 years.
Wow, long time.
Yeah. And her income is fixed. Social Security, a small pension. She's budgeted carefully for decades.
How's every penny?
Precisely. And for her, programs like Medicare and SNP, the food assistance program, they aren't just line items. They're absolute lifelines. They let her stay independent, stay in her home.
Vital support.
But then things started to shift. She got notice her Medicare Part B premium was going up. Yeah, taking a much bigger bite out of that fixed check. And then on top of that, her SNP benefits were reduced.
At the same time.
At the same time. And this is happening just as grocery prices, basic things like eggs and bread, were climbing.
The worst timing.
Right. So imagine Eleanor in the grocery store. She used to enjoy fresh berries. Maybe now she's looking at them, but she has to put them back because buying them might mean she can't afford something else essential.
That's heartbreaking.
It is. She found herself facing this awful choice. Do I buy my heart medication, which she absolutely needs, or do I make sure I have enough food for the whole week?
Medicine versus food. That's not a choice anyone should have to make.
Absolutely not. And it's not just math for her. It's this constant, quiet anxiety. The fear of getting sick because she skipped her meds, or the stress of not having enough food, feeling forgotten maybe.
Yeah, invisible.
After contributing her whole life. It really drives home that this isn't just about federal budgets. It's about a senior citizen's daily agonizing reality.
Eleanor's story, it perfectly illustrates what we mean when we talk about vulnerable populations.
It gives it a face.
Exactly. These aren't just abstract categories we use in reports. They're groups of actual individuals who are at a much higher, disproportionate risk for health problems and what we call health disparities.
Meaning differences in outcomes.
Right. Differences in health outcomes that are directly linked to social, economic, or environmental disadvantages. And these disadvantages, they often act as real, significant obstacles to getting and staying healthy.
Based on things like...
Well, based on characteristics like socioeconomic status, how much money you have, basically,
All right.
or age, like with Eleanor, or having a disability.
Okay.
And when we talk about vulnerable populations, it's a pretty wide spectrum. You've got the very young and the very old, obviously, people with chronic illnesses or disabilities, veterans who might be dealing with the after effects of service. Racial and ethnic minorities often face systemic barriers, the LGBTQ population. Victims of human trafficking, which is a horrific reality. Incarcerated individuals and their families face unique challenges.
That makes sense.
Rural Americans often have less access to services. Migrant workers face really precarious conditions. People with chronic mental health disorders.
Yeah.
And of course, people experiencing homelessness.
That's a really broad list.
It is. And the common thread is that these groups, in various ways, often experience less access to health care. They use health services less frequently, maybe because of cost or availability or trust.
Right.
And this leads directly to measurable disparities. Lower life expectancy, higher rates of illness, higher mortality rates. It really challenges that idea that everyone has an equal shot at a healthy life.
So, okay, when policies change, when support is reduced, like in Eleanor's case, what does that practically mean for people in these different groups? How does it actually play out day to day?
Well, it translates directly into those incredibly difficult choices, just like Eleanor faced. When government subsidies for health care or funding for social safety net programs gets cut or pulled back, people are forced into these stark trade-offs. It hits their most basic needs. You mentioned the elderly. Well, some analyses have shown direct links between cuts to Medicaid, for example, and elderly folks being pushed out of nursing homes prematurely.
Seriously? Where do they go?
Sometimes they end up relying on family members who might already be stretched thin. In the worst cases, they can end up homeless.
That's terrible.
It is. And similarly, think about people who rely on the Affordable Care Act, the ACA, for their health insurance.
Okay.
If the subsidies that help make those plans affordable are reduced or eliminated, suddenly their insurance becomes completely unaffordable.
So they just lose coverage.
Millions can end up pushed back into the ranks of the uninsured.
Right.
Which means they might skip critical preventive care, delay necessary treatments.
And then face huge medical bills if something serious happens.
Exactly. Catastrophic medical debt. And that creates this cascade of other problems. Impacts their ability to work, their mental health, their overall stability. It's a downward spiral. And another really crucial example, one that maybe doesn't get enough attention in these policy debates, is the impact on working mothers and the whole childcare system.
Childcare. Yeah, that's huge.
It's fundamental. Think about the story of Claudia Swanson. She finally managed to get a daycare spot for her daughter, which, as you know, can be incredibly hard to find and afford.
Like winning the lottery sometimes.
Right. And that spot was critical for her to keep her job as a social services case manager. But then suddenly the center just shut down.
Oh no, why? Funding issues.
Often it is funding or staffing.
Yeah.
The reasons can be complex, but the effect is devastating. For Claudia, it wasn't just an inconvenience. She said she lost hope. She ended up having to quit her job. She nearly lost her house.
Wow.
She described it as going from being a social services case manager and a leader to becoming a client myself. That sudden loss of essential childcare, it just destabilizes everything.
It makes holding down a job almost impossible for many parents.
Absolutely. It really highlights how affordable, reliable childcare isn't just a family issue. It's fundamental economic infrastructure. It directly affects women's ability to participate in the workforce and maintain financial stability.
And isn't there a big funding issue looming for childcare right now? Something that could make this situation even worse for a lot more families.
Precisely. That's a really important point. There was a key piece of legislation, the American Rescue Plan Act, which provided this critical one-time boost of $24 billion specifically for childcare stabilization.
Okay, I remember that.
It was a lifeline, genuinely. It helped over 200,000 childcare providers across the country keep their doors open during a really tough time.
So that was good.
It was very good. But, and this is the crucial part, those funds came with a deadline. They have to be spent by September 30th, 2025.
The funding cliff.
Exactly. That's what economists and policymakers are calling it. And the potential implications are, frankly, dire. Current predictions suggest that without some kind of further action or funding, as many as 70,000 childcare facilities across the U.S. could close.
70,000? That's huge.
It is. And that could potentially leave 3.2 million children without care.
3.2 million?
It's not just a statistic. It's a potential crisis for working families. And look at the timing. This is happening when women, particularly those between 25 and 54, have reached a historic high in labor force participation, around 78%.
Right, women have been driving recent workforce gains.
Exactly, and mothers with young children are leading that surge, around 70% participation. But that progress, it's incredibly fragile.
So this childcare cliff could reverse those gains.
It absolutely could.
Yeah.
A widespread loss of childcare could pull women, especially mothers, out of the workforce in large numbers. That doesn't just hurt individual families, it slows down overall economic growth and could even add to inflationary pressures if the labor market shrinks.
And it probably hits some harder than others.
Definitely. Many working mothers, particularly low-income mothers and mothers of color, often don't have the option of flexible telework or other arrangements. They basically no wiggle room to manage if their childcare disappears. The impact to them is immediate and often devastating.
It really sounds like focusing just on the savings from these cuts misses the bigger picture. It's not just about a line item on a balance sheet. There's this cascading effect, these systemic consequences for people's well-being and even the broader economy.
Absolutely. That's a crucial point to grasp. And if you look back historically, it's pretty unequivocal. Government spending on public services, on social welfare, it's been deeply, almost inextricably, tied to both economic progress and social progress throughout modern history.
So the idea that private charity can just pick up the slack?
It's unrealistic. Philanthropy is valuable, absolutely, but it could never realistically meet the full range of societal needs, especially during big shifts like industrialization or major economic downturns. History shows that.
And analyses confirm that these kinds of budget cuts can lead to, what did you call it, a dismantling.
Yeah, some scholars use that term, a massive dismantling of the welfare state. And what does that actually mean on the ground? Well, it translates pretty directly into lower quality public services, fewer available services.
Like longer waits, less access.
Exactly, which then leads to worse public health outcomes, a general decline in social welfare, and almost inevitably, a rise in social inequality. And, not surprisingly, you often see widespread public opposition to those austerity measures.
Right, people feel it directly.
They do. It also puts policymakers in a tough spot. Instead of focusing on improving services, making things better, their energy shifts to just trying to maintain the basics, maybe even cutting back further.
So, like reducing how long someone can get benefits or making the eligibility rules stricter?
Precisely those kinds of things. And the cumulative effect of all that is often a reduction in the overall standard of living for a significant portion of the population. It's a profound shift in how a society chooses to support or not support its citizens.
That makes a lot of sense intuitively. But you still hear the argument, don't you, that supporting these populations, these programs, is just throwing money at problems, that it's a drain, that there's no real return. Is there actual evidence that investing pays off?
That is an incredibly important question. And yes, there is compelling evidence challenging that drain narrative. What happens if we actually invest strategically in social supports? The data suggests it can yield substantial returns, not just for the individuals helped, but for society as a whole.
Okay, like what?
Well, take the findings from a UCLA study. They looked at providing targeted housing assistance to people experiencing homelessness. This wasn't just giving someone keys. It was a structured approach to providing stable housing.
Right, housing first.
Exactly, that approach. And within just 18 months, which is a remarkably short time frame, this assistance led to really significant results.
Which it does.
Okay, get this. Emergency department visits dropped by 80%.
80%.
Yeah. Jail days were reduced by 130%, meaning people spent drastically less time incarcerated. The probability of committing a crime dropped by 80%. And, crucially, the probability of someone reporting being employed increased by 24 percentage points. Wow.
So stable housing was the key to unlocking all that.
The research strongly supports that view, that providing stable housing first is actually the most cost-effective and, frankly, humane way to help people get back on their feet rather than trying to fix other problems while they're still on the street. And there's another really compelling example from the Veterans Health Administration, the VHA. They have something called the medical home model, specifically for homeless veterans.
Okay, what's different about that?
It's not just a standard clinic. It's designed to be proactive. It's based in primary care, uses interdisciplinary teams, doctors, social workers, mental health professionals all working together, and it's really focused on patient-centered, holistic care.
So looking at the whole person.
Exactly. And critically, it focuses on low threshold access. That means things like having walk-in capacity, doing street outreach to meet veterans where they are, removing those common barriers to care.
Makes sense.
They also offer integrated services. So mental health and primary care are under one roof. Plus, they help with immediate needs, food vouchers, hygiene kits, things like that. And they emphasize continuous care management so people don't fall through the cracks.
I mean, did it work?
Demonstrably.
Yeah.
This model significantly reduced emergency department visits and hospitalizations among the homeless veterans it served. Why? Because it directly addressed the social determinants of health, like homelessness, lack of food, mental health issues within the clinical care framework itself.
So by tackling the root causes.
They improved health outcomes and reduced reliance on expensive emergency care. It shows that investing in comprehensive support works. And if you connect this to the bigger picture, achieving what we call health equity, the highest possible level of health for all people, it requires us to truly value everyone equally.
It's not just about treating sickness.
No. It demands focused, ongoing efforts as a society to address those avoidable inequities, those historical injustices that prevent certain groups from reaching their full health potential. It's about creating the conditions where health can actually flourish for everyone.
Okay, let's pivot back to that Nebraska town hall for a moment. That reported shout, "You do not get free health care."
It felt like more than just a budget point, didn't it? As we said in the opening, many heard it as a kind of declaration about who matters.
It certainly landed that way for many in the room, it seems.
And that really brings us to the structure of our democracy itself and how it can be, well, reshaped from within, sometimes in ways that aren't immediately obvious.
The rules of the game themselves.
Exactly. And we've seen other moments that really throw this into sharp relief. I mean, there was that widely reported instance where a former president apparently told Texas officials to redraw their congressional map specifically to favor his party.
I remember that controversy.
And then when Texas Democrats actually left the state to break the quorum and stop that redistricting vote.
A dramatic move. The governor ordered their arrest. It's just such a vivid picture of these raw power struggles playing out, where drawing lines on a map becomes this high-stakes battle over who gets political power and representation.
That is a perfect segue into this whole concept of partisan gerrymandering.
Right. Explain that a bit.
So every 10 years, after the census counts everyone, states have to redraw their district boundaries for Congress, for their own state legislatures to make sure populations are roughly equal.
Okay, standard process.
Supposedly. Done impartially, the goal is fair representation. But what often happens is that the party in power at the time strategically manipulates, or you could say rigs, those maps to favor their own candidates or party.
So they draw the lines to help themselves win.
Essentially, yes.
Yeah.
And partisan gerrymandering is fundamentally undemocratic because it flips the script instead of voters choosing their politicians.
Politicians choose their voters.
Precisely. By designing districts where the outcome is virtually guaranteed before anyone even votes. It doesn't matter if public opinion shifts statewide, the map locks in certain results. In really extreme cases, a party can win a solid majority of the seats, even if they get fewer votes statewide than the other party.
Which completely undermines the idea of majority rule.
Absolutely. Now, there are two main techniques they use, often together. The first is called cracking.
Cracking.
Yeah. You take voters from the opposing party or a specific demographic group that tends to vote against you, and you spread them thinly across many different districts.
So they're always the minority everywhere.
Exactly. You dilute their voting power so they can't form a majority in any single district, making it impossible for them to elect their preferred candidate in those areas.
Okay, that's cracking. What's the other one?
The other is packing. This is where you cram as many of the opposing party's voters as possible into just a few districts.
So they win those districts overwhelmingly.
Right, maybe with 80 or 90% of the vote. But by concentrating them there, you make the surrounding districts much safer for your own party because you've removed those opposition voters from the pool. It basically wastes their votes in those packed districts.
Clever, in a way.
It is.
Yeah.
And what's really interesting and kind of counterintuitive is that you can't always spot a gerrymandered district just by looking at its shape anymore. Gone are the days of only bizarre, snake-like districts, though those still exist.
Right, they used to look really weird.
Sometimes they still do, but a skilled modern gerrymanderer using sophisticated mapping software and incredibly detailed voter data can create districts that look perfectly neat and compact, maybe nice squares or rectangles, but are still incredibly skewed politically.
How?
By sorting voters with surgical precision. Take North Carolina's congressional map as an example. On the surface, it looks geographically fairly reasonable. But the way it sorts voters is so precise that the Republican Party is virtually guaranteed to win 10 or maybe even 11 out of the state's 14 congressional seats.
Even though North Carolina is considered a swing state.
Exactly. It's a politically competitive battleground state. But the map produces this wildly skewed result, locking in an advantage regardless of the statewide vote.
Okay, so it's definitely not just about weird shapes. How much does this sophisticated gerrymandering actually tilt the scales? How much does it impact who holds power, both in the states and nationally?
Oh, significantly. It has a major impact on the balance of power, and the effects ripple across the entire country. After the 2020 census, for instance, the Republican Party happened to control the whole redistricting process in more states than the Democrats did.
So they held the pen in more places.
They held the pen in more places, and analyses suggest they used that advantage aggressively to draw maps favorable to their candidates. Some estimates indicate that the congressional maps used in the 2024 election cycle had, on balance, about 16 fewer Democratic or Democratic-leaning districts nationwide than you would have expected if the maps had followed strong, nonpartisan anti-gerrymandering rules.
16 seats that can make a huge difference in a closely divided Congress.
It absolutely can. And North Carolina, which we just talked about, is a perfect case study of that national impact. Remember, their state Supreme Court initially threw out the 2021 map as an illegal partisan gerrymander.
Right.
A court-appointed expert then drew a more neutral map, and in the 2022 election under that map, the state sent an evenly split delegation, 7 Democrats, 7 Republicans, to the U.S. House.
Okay, reflecting the state's purple nature.
Exactly. But then, the composition of the state Supreme Court changed due to elections. The new court reversed the previous ruling, basically saying the legislature could draw partisan maps after all. So the Republican-controlled legislature redrew the map again, making it highly favorable to them. And the direct result, after the 2024 election, was that 3 previously Democratic districts flipped to Republican.
Just 3.
Just 3. But in a narrowly divided U.S. House, those 3 seats were enough to potentially determine which party held the majority. It shows the immense power wielded in drawing just a few lines. Now, of course, it's crucial to say this isn't exclusively a one-party issue. When Democrats have control, they often do it too.
Like in Illinois.
Illinois is a prime example. Democrats there controlled the process and drew a map that was incredibly aggressive, reducing the number of Republican seats to just 3 out of 17. That's the fewest GOP seats in Illinois since the Civil War era.
And a fair map would have looked different.
Nonpartisan analyses suggested a fair map probably would have resulted in around 6 Republican seats. So yes, both parties engage in maximizing their advantage when they hold the power to draw the maps.
It really feels like the basic rules of the game are being stretched, maybe even broken. How did we get here? Especially with the courts, you'd think they would step in to stop this kind of manipulation, wouldn't you?
It's a really important question about the legal framework and, well, the checks and balances in our system. Gerrymandering itself isn't new. The term dates back to Governor Elbridge Gerry in Massachusetts in 1812.
Right, the Salamander District.
Exactly. But what's drastically different today are the tools. Modern map drawers have incredibly powerful computers, complex algorithms, and voter data down to the individual household level.
Way beyond hand-drawn maps.
Oh, absolutely. They can generate and analyze thousands, even millions, of potential map configurations to find the one that gives their party the biggest, most durable advantage. It's become a science.
And the courts haven't stopped it.
Well, that's where it gets complicated. A really pivotal moment was the Supreme Court's 2019 decision in Rucho v. Common Cause.
What did that case say?
In Rucho, the court essentially ruled that claims of partisan gerrymandering maps drawn purely to favor one political party present a political question that is beyond the reach of federal courts.
So federal courts can't intervene just because a map is politically unfair.
That's the gist of it. Even though the court itself acknowledged in the ruling, and I'm quoting here, that extreme partisan gerrymandering is inconsistent with democratic principles.
They still said they couldn't do anything about it.
They decided it wasn't the role of the federal judiciary to police it. They basically said voters or state courts or Congress would have to find solutions. This ruling effectively shut down a major avenue for challenging these maps. And an earlier case, LULAC v. Perry, had already given the green light to states redrawing maps mid-decade for partisan gain, not just after the census.
So they can do it more often now, too.
If a party gains control of a state legislature between census counts, yes, that ruling suggests they can redraw the maps again to lock in their advantage. Now, this legal situation has also created a really concerning loophole when it comes to racial discrimination in voting maps.
How so?
Because in many parts of the country, especially the South, how people vote correlates strongly with race. Democrats tend to get overwhelming support from black voters, for instance.
Right.
So since the Rucho ruling said federal courts can't rule on partisan gerrymandering, map drawers in some states have started defending maps that clearly dilute the voting power of minority communities by claiming they're just discriminating based on party, not race.
So they argue, we're not targeting black voters, we're targeting Democrats.
Exactly. They use partisanship as a shield. This map disadvantages Democrats, which is legally allowed under Rucho, not black voters, which would be illegal under the Voting Rights Act. We see this argument playing out right now in places like South Carolina.
So it makes it harder to challenge maps that harm minority voters.
It creates a significant legal hurdle. Naked partisanship becomes the excuse to undermine the voting strength of often fast-growing communities of color. It's a really complex intersection of race, party, and voting rights law.
Okay, so redistricting is clearly a powerful tool for shaping democracy, but what about actions taken directly by the executive branch? We mentioned that hypothetical Arizona family earlier, living in that gray area of legal status, maybe seeing new detention centers being built nearby. How did those kinds of unilateral executive actions affect the democratic balance?
That scenario, it really highlights how executive actions, especially sudden or sweeping ones, can create profound instability. And over time, that instability can seriously erode public trust in the fairness and predictability of the system.
Because the rules keep changing.
Exactly. Imagine being that family. Maybe you've been in the U.S. for years, decades even. You've built a life. Maybe you have U.S.-born children. You pay taxes. You're part of the community. But your legal status remains precarious, dependent on shifting executive policies or interpretations.
Waiting for the next announcement.
Right. One day, a new executive order might come down that threatens your ability to work or changes the rules for deportation or shuts down a pathway to residency you were counting on. The next day, a court might put that order on hold, offering a temporary reprieve.
A roller coaster.
Absolutely. And then maybe that court ruling gets appealed, throwing everything back into uncertainty. When you see new, large-scale immigration detention centers going up nearby, it's not just a building project. For families in that situation, it's a constant, visible symbol of the potential consequences, a daily reminder of how precarious their existence is.
That sounds incredibly stressful.
It is. And this constant back and forth, with the courts often playing catch-up to major policy shifts decided unilaterally by the president, it really exposes a vulnerability in our system's balance of power. The lives of millions can be dramatically altered, not by laws passed through Congress after debate and compromise, but by the stroke of an executive pen.
Leaving the courts to sort out the mess.
Leaving the courts to manage the often chaotic aftermath, and leaving countless families stuck in this limbo, unable to plan for the future, constantly living with fear and uncertainty. How do you plan for your kids' education or invest in your community under those conditions? It's a fundamental challenge to stability and belonging.
So these are clearly deep, systemic issues, gerrymandering, executive overreach, the legal battles. Is there any way out? Can anything actually be done to counter these trends, or are we just stuck watching the system get more polarized and less responsive?
It can feel discouraging, for sure, but if we connect this back to the bigger picture, even though the Supreme Court has largely stepped back from policing partisan gerrymandering, Congress does still have the power to act. They can set national standards.
Okay, how?
Well, for example, there was the Freedom to Vote Act. It was introduced back in 2022, and it actually passed the House of Representatives.
What would that have done?
It was a comprehensive bill aimed at addressing many of these issues head-on. Critically, it would have banned partisan gerrymandering in congressional elections nationwide. States would have had to follow clear rules to prevent drawing maps just to favor one party.
So national standards for fairness.
Exactly. It also aimed to strengthen legal protections for voters of color, making it harder to use that Rucho loophole we talked about to dilute minority voting strength. It included provisions for greater transparency in the map drawing process, requiring public input, and making the data available.
And could citizens challenge bad maps?
Yes. It aimed to improve voters' ability to challenge gerrymandered maps in court and, importantly, get timely relief, meaning stop an unfair map from being used for an election cycle while the case is decided.
So what happened to it?
Ultimately, it failed to pass the Senate. It ran into the filibuster rules, which require 60 votes to advance most legislation.
So it died there.
It did for that session.
Yeah.
But the fact that such detailed legislation exists, that it passed one whole chamber of Congress, shows that there is a clear legislative path forward. It lays out a blueprint for how fair representation could be protected for all Americans.
So the potential for change is there, even if the political will isn't yet.
Precisely. The hope among reformers is that eventually, perhaps as both parties experience the negative effects of extreme gerrymandering when they're in the minority, there might be growing bipartisan recognition that uniform, fair national standards actually benefit everyone by creating a more stable and responsive political system. It could be a long game, but the possibility exists.
Let's bring it back to that Nebraska town hall again and the economics of it. That reported exchange, the congressman saying the country doesn't have endless money, but then adding that the billionaires do, and implying his vote was to give more to billionaires.
Yeah.
It just cuts right to the bone of economic inequality, doesn't it?
It really crystallizes that tension.
Especially when, as we know, the cost of basic necessities like food has been rising so sharply, often faster than overall inflation. That hits everybody, but especially people on tight budgets.
Absolutely. The grocery bill is a constant reminder.
Right. Think about someone like Michael. He's a hypothetical young public school teacher, maybe in a big city like Los Angeles. He's dedicated, he loves his job, works hard, often with students from low-income backgrounds. But his salary, despite his qualifications and importance, just isn't keeping up with the soaring cost of living.
A common story in many professions, unfortunately.
Totally. His grocery bill, he calculates, is maybe 30% higher than just a few years ago. Rent eats up most of his paycheck. There's very little left over.
Living paycheck to paycheck.
Exactly. And then he hears politicians talking about fiscal responsibility, the need to cut wasteful public spending, targeting welfare programs. For Michael, that's not abstract political talk.
No, it's personal.
It means potentially fewer resources for his students, maybe cuts to school programs, larger class sizes. And on top of that, he feels this gnawing stress just to make his own ends meet. Meanwhile, he reads about tax policies that seem to disproportionately benefit huge corporations and the ultra-wealthy.
Seeing vast fortunes made elsewhere.
Right. In the stock market, while the public safety nets that he relies on sometimes and that his students' families definitely rely on seem to be shrinking. It creates this feeling for many people, I think, that the system is rigged, that the ladder is being pulled up while they're still struggling on the lower rungs.
That sense of unfairness is palpable for many. And Michael's story, it's a really powerful personal lens for looking at the bigger economic picture. It helps us investigate the rationale behind certain fiscal policies that often reduce public welfare spending while either directly or indirectly favoring wealth accumulation at the very top.
The trickle-down idea.
Well, for decades, the dominant economic approach, often labeled neoliberalism, really promised that things like lower taxes on corporations and the wealthy, widespread deregulation, privatization of public services, that these policies would unleash market efficiency and create robust economic growth that would eventually trickle down and benefit everyone.
That was the sales pitch.
That was a core promise. Free up capital, reduce government interference, and the whole economy flourishes, lifting all boats.
But did it work out that way? What does the research actually show?
Well, a pretty large body of empirical research consistently challenges those claims. First off, the U.S. economy didn't actually grow faster after these policies took hold. If you look at the numbers, average annual GDP growth was about 3.9% between 1950 and 1980.
Okay.
But since 1980, which is roughly when these neoliberal policies gained real traction, that average growth rate has actually slowed down to about 2.6%.
So slower growth, not faster.
Slower overall growth. And instead of broad benefits trickling down, what we saw was a really significant, undeniable increase in income inequality.
Oh, big an increase.
The income share going to the top 1% of earners. It went from about 8% of total national income in 1979 to around 18% by 2017.
Wow, more than doubled.
A huge shift. And what's interesting is how that inequality grew. In the 80s and 90s, it was mostly driven by differences in wages, labor income. But since about 2000, the main driver has shifted to capital income money made from owning assets like stocks, bonds, real estate.
So wealth generating more wealth at the top.
Largely, yes. And related to that, the overall share of national income going to labor, essentially, workers' paychecks actually fell. It was about 85.3% in 1980 and dropped to 78.5% by 2011. Wage growth for most people basically stagnated.
Stagnated, even with inflation.
After adjusting for inflation, yeah. Average hourly wages for the majority of workers have only increased about 0.6% per year since 1980. Barely keeping up. And maybe the most damaging finding for that trickle-down idea relates to economic mobility.
Moving up the ladder.
Right. Relative mobility, your chances moving up or down compared to your peers, that hasn't really improved much, if at all.
Right.
But absolute mobility, the chance of earning more than your parents did that has fallen dramatically.
Dramatically.
Get this. About 90% of children born in 1940 ended up earning more than their parents did. That was a core part of the American dream narrative.
Okay.
But for children born in the 1980s, that number dropped to just 50%. Only half are doing better than their parents financially.
That's a huge decline.
It really is. And interestingly, even institutions you might think of as traditionally supporting market-based approaches, like the International Monetary Fund, the IMF, their research has found that lower inequality, specifically measured after taxes and government transfers, is actually correlated with faster and more durable economic growth.
So less inequality is actually good for growth.
That's what their findings suggest. It directly challenges that old idea that you always have to trade off equality for economic efficiency. It looks like they might actually go hand in hand, or at least aren't necessarily opposed.
Okay, that's a really powerful counter-narrative backed by data. So if the evidence doesn't really support the idea that giving more to the top benefits everyone, why do these kinds of policies seem to persist? And why isn't the usual answer just get more education, build your skills? Why isn't that fixing the inequality problem?
That's a crucial question, and it really gets at the limits of what's often called the human capital argument. The idea that inequality is mainly about individuals needing to invest more in their own education and skills to earn higher wages.
Right, the individual responsibility argument.
Exactly. And while education is undoubtedly vital, it doesn't fully explain or solve the kind of systemic economic inequality we're seeing. For one thing, our education system itself often mirrors and sometimes even reinforces existing inequalities.
How so?
Well, the quality of K-12 education is often tied to local property taxes, meaning wealthier areas tend to have much better funded schools than low-income areas. So access to quality education isn't equal from the start.
So it reproduces inequality rather than correcting it.
Often, yes. Plus, a lot of the significant economic inequality we see today isn't just between, say, college graduates and high school graduates. It's increasingly between people working at a highly profitable, often dominant super firms versus those working at less profitable companies, even if they have similar skills.
So it matters where you work, not just what you know.
Increasingly, yes. If wages are tied to these superstar firms and their massive profits, sometimes called supermarket rents, because they're so far above the norm, then just getting more skills won't guarantee you a higher wage if you can't get a job at one of those top firms. And look at where we have seen progress in reducing poverty. It's often been driven by direct government action, not just individual upskilling.
Like what programs?
Things like the Earned Income Tax Credit, EITC. That's a tax credit for low to moderate income working families. It directly boosts their income. Minimum wage laws also play a role in setting a floor. These are systemic policy levers.
Not just individual effort.
Right. And more broadly, the evidence suggests that institutional rules and structural conditions, things like tax policy, labor laws, unionization rates, play a huge role in determining overall wage levels and inequality, maybe even more than individual qualifications in some respects.
Can you give an example?
Yeah, sure. Tax policy. Research shows a pretty strong negative correlation between high top marginal tax rates and the income share going to the very top earners. Since the 1960s, the U.S. saw its top marginal tax rate fall by about 45%.
During that same period,
the income share of the top 1% went up by about 10 percentage points. It suggests a direct link between lower taxes at the top and rising inequality.
What about unions?
Unionization is another big factor. Research suggests that if the U.S. had maintained the unionization rate it had in the mid-1950s, which is around 30%, the growth in the income share of the top 10% since then might have been reduced by as much as half. Unions tend to compress wage gaps and give workers more bargaining power.
And what about racial inequality in all this? Does the market fix that?
Well, the old theory that market competition would naturally eliminate racial discrimination because it's inefficient, that's been pretty thoroughly debunked by the data.
How so?
The reality is stark. White households hold significantly more wealth than Black and Latinx households at every single income and education level. Think about that. A Black family headed by someone with a college degree often has less wealth than a white family headed by someone who didn't even finish high school.
That's staggering.
It is. And you see persistent disparities like higher unemployment rates, lower wages for similar work for people of color. these aren't explained by individual choices or skills. They're driven by a whole web of structural factors: historical discrimination in housing, redlining in lending, and hiring practices that continue to have effects today.
Okay, so if these top-down policies aren't delivering for most people and inequality is baked in structurally, what about inflation? That's something everyone feels directly, right? How does that fit into this economic divide?
That's a really important piece, because inflation doesn't hit everyone equally. An analysis by the European Central Bank, the ECB, looked at this closely for the euro area during the recent inflationary surge.
And what did they find?
They found, quite clearly, that high inflation disproportionately harms lower-income households. And there are a couple of key reasons why.
Okay.
First, lower-income households spend a much higher share of their total income just on basic consumption. They often have little or no savings. Sometimes they're even in debt, spending more than they earn.
So most of their money goes to essentials.
Right. And second, a larger proportion of that spending goes towards necessities like food and energy. And guess what saw the biggest price increases during the recent inflation spike?
Food and energy.
Exactly. So they get hit twice as hard. The ECB calculated that for the euro area in 2022, the impact of price increases meant a drop in consumption welfare, basically. How much stuff they could afford of over 13% for the lowest income households.
13%. How did that compare to the richest?
That impact was 2.8 times higher than the drop experienced by the highest income households. It really shows how inflation acts like a regressive tax, taking a much bigger bite out of the budgets of the poor. Now, governments across Europe responded with pretty significant fiscal measures to try and cushion that blow, spending almost 2% of their GDP on average in 2022.
What kinds of measures?
They generally fell into two buckets. About half were income measures,
Hmm.
things like direct cash payments to families or targeted tax credits.
Okay, putting money in people's pockets.
Right. The other half were price measures,
Hmm.
things like putting caps on energy prices or temporarily reducing the VAT, the value-added tax, on certain essential goods.
Did those help lower inflation?
The price measures did have an effect, yes. The ECB estimated they lowered overall consumer inflation by about 1.6 percentage points across the euro area. So they provided some relief on that front.
But did people still end up worse off?
Unfortunately, yes. Despite those government measures, and even with some people's wages going up a bit, overall household purchasing power still dropped by an average of 2.2 percentage points across the euro area. People could still buy less.
But did the government help narrow the gap between rich and poor that inflation was widening?
That's where the income measures really made a difference. Looking at the distribution, government income support contributed much more to the disposable income growth of the poorest households, adding about 3% for the bottom 10% compared to the richest, who only got about a 0.4% boost from those measures.
So government action helped offset some of the market impacts.
It definitely helped close the income growth gap that market forces alone were creating. In contrast, market income growth from wages, investments mainly benefited the richer households during that period.
So overall, despite the challenges, were these government efforts effective? Did they actually manage to close that huge inequality gap created by inflation?
They made a really significant contribution. Looking at the euro area as a whole, that welfare gap between the poorest and richest households, which inflation had blown out to about 8.4 percentage points, was closed by around 60%, thanks to all those compensation measures put together.
60% is pretty substantial.
It is. It really demonstrates the power government intervention can have in mitigating the worst effects of economic shocks on the most vulnerable. But, and this is a key takeaway from the ECB analysis,
Yeah.
most of the fiscal measures used were not particularly well targeted specifically at lower-income households.
Especially the price measure.
Exactly. Price measures like energy price caps or VAT cuts, they benefit everyone who consumes that good or service, regardless of their income. So while they lower inflation overall, they're not very efficient if your main goal is reducing inequality. You end up giving subsidies to high-income households who might not need them as much.
Whereas the income measures.
The analysis found that the targeted income measures were actually 3 times as effective in reducing that inequality gap for every euro spent compared to the price measures.
Wow, 3 times more effective.
Yeah, which strongly suggests that governments could have protected vulnerable households just as well, or even better, against inflation, but at a much lower overall cost to the public purse if they had focused more heavily on those targeted income supports instead of broad price controls.
So the design of the policy really matters.
Immensely. And the experience wasn't uniform across countries either. Places like France, Italy, and Portugal managed to almost fully offset the welfare losses from inflation for their citizens through their policy mix. But in Germany and Spain, significant gaps remained, with lower-income households still feeling a much bigger hit to their disposable income. It really highlights that while fiscal policy can be a powerful tool against inflation and inequality, how you design and target those policies makes all the difference in their effectiveness and fairness.
So when you put it all together, it seems clear that angry outbursts back in Nebraska, it really was just one loud ripple from this much deeper, much more complex reality we've been exploring.
Exactly, a symptom, perhaps.
Yeah. We've seen how cuts to social safety nets aren't just numbers. They have these profound, sometimes devastating human costs. We've looked at how the very rules of democracy, through things like gerrymandering or executive actions, can be bent or reshaped to consolidate power.
Shifting the ground beneath our feet.
And we've examined how economic policies, whether they're intended to or not, can end up widening that already huge chasm between those who have incredible wealth and those who are just struggling to get by day to day. It really is this intricate tapestry, isn't it? Woven from individual stories like Eleanor's or Michael's and these huge macro-level forces.
It absolutely is. And what's truly striking, I think, is that constant tension you see between the abstract world of policy debates, the arguments over budgets, the regulations, the economic theories, and the actual tangible lived experiences of people.
People just trying to live their lives.
People like Eleanor trying to afford medicine, Claudia trying to find childcare, Michael trying to make rent, that Arizona family living with uncertainty. Understanding these connections, how a decision made in Washington or a state capitol about a budget line or a voting map or an executive order, how that plays out in someone's health, their security, their opportunity, that understanding is just critical.
Because it's not abstract for them.
Not at all. The data, the stories, they consistently show us that what might seem like a distant policy choice can have an immediate, sometimes indelible impact. It really does influence who matters and who feels left behind in our society. It fundamentally shapes that landscape of individual struggle and success. It's a constant reminder, I think, that beneath all the numbers and the political rhetoric, there are always real lives being affected.